Hello and welcome. I'm Vincent MAKORI and this is Africa 54. Now, malaria, it's public enemy number one, especially in Africa. And on this World Malaria Day, signs of real progress. First, here are the facts. An estimated 219 million people are infected with malaria each year. The disease causes about 660,000 deaths annually. But there is good news. 33%, rather there's a 25% drop in malaria cases globally and a 33% drop in sub-Saharan Africa, all since the year 2000. For more, let's go over to Africa 54's health correspondent Linord Moudou. Hi, Linord.
Hello, Vincent. Hello, everyone. Well, malaria once afflicted people in nearly every country on the planet. Insecticides and eradication campaigns over the past century have contained the mosquito-borne disease to fewer than 100 countries. Yet, in those mainly tropical countries where malaria is still prevalent, it kills more than 500,000 people each year. Most of them are children under the age of 5. Voice of America's Carol Pearson reports on progress that has been made and the work that still remains to be done.
These are the faces of those most likely to die from malaria. For every minute that goes by, a child under the age of 5 dies from malaria. Malaria has been diagnosed on every continent, but sub-Saharan Africa is the region most afflicted. Dr. Anthony Fauci, who heads malaria research at the U.S. National Institutes of Health, calls the parasitic disease one of the world's worst killers.
We've made substantial progress in a global community way with malaria because there are several countries that predict that by 2015 they will have substantially, by more than 50%, up to 75% decreased the incidence of malaria. Having said that, as the good news, the sobering news is that we still have 660,000 deaths per year from malaria.
Multiple strategies have been used to fight malaria. Bed nets treated with insecticide protect against mosquito bites. Those infected are treated with drugs early before their disease turns deadly. Pesticides are sprayed to control mosquito populations. Several researchers, including those at Johns Hopkins School of Public Health in Baltimore, are trying to change the mosquito that transmits the parasite that causes malaria. The director of the Malaria Research Program at Johns Hopkins, Dr. Peter AGEE, spoke to VOA by Skype.
We could stop this and we could control the mosquitoes by either eliminating them, which is very difficult to do, or treating them to make them less effective to carry the infection.
Dr. AGEE says Johns Hopkins has had great success with the mosquito treatment strategy in Zambia, where its researchers are working with an established hospital.
The burden of the disease has been knocked down by 98% in a decade. So we've gone from a region with 1,500 children being admitted to the hospital each year to a couple dozen.
But the success of the global anti-malaria campaign could also be its weakness, according to Dr. Fauci.
My concern about even saying there's good progress is that we have been here before, not only with malaria, but with other diseases. When you start to see a downtick in things, people say, well, we have the process or the disease under control. We can move on to emphasizing other things, which would be a really bad mistake.
Dr. Fauci notes there is no vaccine yet against malaria. Mosquitoes that transmit it are becoming resistant to pesticides, and in some places, the malaria parasite is becoming resistant to the drug that treats it. Complacency and cuts in funding could allow malaria to reestablish itself in areas where it has been reduced or eliminated. And the human stakes are still high. In the time it has taken for this report, 3 more children have died from malaria. Carol Pearson, VOA News.
And now to northern Kenya, where researchers are using mobile testing kits to reach residents in rural communities. The goal is to enable early diagnosis and treatment of malaria in communities without access to health facilities. It is hoped that the kits will also discourage cases of self-medication in the country. The portable kits were launched in Kenya last year as part of a government policy on universal diagnosis of malaria for people of all ages. The process begins when a blood sample is drawn and placed on the test kit slot. A buffer solution is then added, and a few minutes later, well, the kit gives a reading. Local healthcare workers explain its benefit.
There are two lines, demarcation lines. When there is a control and the test, when both lines are seen, it confirms that the client has malaria, and that's the time you will give the malaria kits. You will give the malaria tablets.
We don't get severe cases of malaria because malaria is being managed at that level of health center and dispensaries. Most of the cases now we get for complicated cases of malaria reduced. The admission rate of malaria is also reduced, which was a bit high the other years.
And nearly 8 million mobile testing kits have been distributed, and another 11 million are expected to be rolled out during the year. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.